Hi, we are from Group 10, consist of Danial, Haikal bin Muhamad Effendy, which is our group leader, me, myself, Mohd Hisyam bin Ilias, Alya Dayana Binti Ismail Hamdi, and Kwong Jia Er. Contractures are common following acquired brain injury. Contractures are undesirable because of their potentially serious implications on motor recovery, functional outcomes, and care needs. Majority of people who suffer critical traumatic brain injury (TBI) may develop contractures. Traumatic brain injury, or known as TBI, is a form of acquired brain injury that occurs when a sudden trauma causes damage to the brain. Symptoms of TBI can be mild, moderate, or severe, depending on the extent of the damage to the brain. The contributors to contracture are physical inactivity that results in muscle weaknesses and spasticity. Spasticity and muscle weakness are both common primary motor impairments and often coexist after an acquired brain injury. Muscles can be further weakened through disuse. Severe weaknesses or lack of muscle activation immobilize a limb and deprive soft tissue of stretch. Contractures occurs when muscle fibers consistently remain in a shortened state, causing a fixed tightening across the associated joints. This causes a decrease in range of motion and frequently limits one's functional capacity. Spasticity is a condition in which the muscles are continuously contracted, causing tightness and muscle shortening. For individuals who have had a TBI, the most common cause of contractures is spasticity. The longer the muscles stay contracted, the shorter the muscle becomes, until eventually a contracture sets in. Trauma is one of the top 5 leading causes of death and hospitalizations in Malaysia. Majority of the trauma cases are from traffic accidents contributed by motorcycle crashes, which sustain the highest percentage of injury at the head and neck part. Traumatic brain injury (TBI) is one of the inevitable major complications that occurs among the trauma survivors. TBI is the most common cause for significant disability and morbidity after trauma. The symptom of TBI is coma and lost consciousness, which lead to inactivity of muscles since the patient was admitted to intensive care unit, or known as ICU. For our clinical issue, the problem statement is that contracture happens when muscle fibers are in a shortened state for a long time consistently, which leads to the excessive plantar flexion of the foot. There are some approaches that can be implemented to tackle this contracture problem, but our aim is to give an early inpatient rehabilitation by the means of orthotic devices. The beginning of early inpatient rehabilitation depends on the severity of the TBI, but most rehabilitation assessments are early referred even when the patient are still in the ICU. The goal for this inpatient rehabilitation program is to maximize recovery of the individual's physical and functional abilities that facilitate independence. Many patients who undergo early inpatient rehabilitation will have a favorable condition to begin retraining their muscles as soon after being discharged from ICU, which can be conducted at sport medicine department that provides suitable equipment depending on the patient's need, from the assessment and guidance of professional therapists and the treatment team. Therefore, we would like to design an adjustable ankle joint orthosis, which is specifically for sitting and standing activities, for the use during early inpatient rehabilitation to tackle the contracture problem that lead to excessive plantar flexion of the foot. 3 laboratory experiments are proposed, which will be further explained by my teammates.
Good day, doctor. I'm Jia Er, and I will present the Lab 1 idea for the ankle foot orthosis design. The lab objective is to test the tensile strength of the materials of ankle foot orthosis through the mechanical testing. A typical AFO consists of a half-cylindrical shell from the shank to the foot, which is made out of thermoplastic. As we are planning to do an AFO, which is adjustable, it will have a joint component, which is made out of metal at the ankle joint. To choose the material to make the shell and the joint, we perform tensile strength tests. Tensile strength tests enable us to know the maximum tensile stress that a material can withstand before it breaks when we apply a force to it at a constant rate of load. It is measured in the unit of force per cross-sectional area. Tensile strength testing is widely used for structural application and mechanical devices. It is an important criteria in determining the most suitable material to measure the structural and personal safety. Materials chosen to be tested for joint are stainless steel and aluminium, while for the shell, we choose the polypropylene (PP) and polyethylene (PE). The apparatus used is the universal testing machine with extensometer. Moreover, the standard for the tensile strength testing is ASTM E8 or EM for metal, while ASTM D638 is for plastic. ASTM is the American Society for Testing and Materials. The picture here is the material specimen that we cut according to the dimensions stated in the standard. And this is the universal testing machine. The hypothesis for this experiment is that the tensile strength of stainless steel is higher than the aluminum, while tensile strength of polypropylene is higher than the polyethylene. The procedure for testing of metals and the plastic are the same, it's just that the standard using are different. First, the stainless steel was cut into standard dimension for ASTM E8 tensile testing, and then the width and the thickness of the stainless steel was measured 3 times to calculate the cross-sectional area to calculate the stress value. Then the correct gauge length was selected based on the stainless steel size we will be testing. And then the stainless steel was clamped with the grips of the universal testing machine, and the extensometer was placed on the stainless steel. The universal testing machine was turned on, and the load was applied to the stainless steel. The machine was stopped once the stainless steel has yield, and the extensometer was removed. The test will continue until the stainless steel fractured. The stainless steel was removed from the universal testing machine once it was broken. The pieces of stainless steel were put together to measure the final distance between the gauge mark to calculate the percent of elongation. The experiment was repeated with the aluminum specimen, and then the experiment was repeated again with polypropylene and polyethylene specimen with the standard STM D638. The expected outcome for this experiment is the material that has higher tensile strength is chosen as a material for the joint and the shell of the ankle-foot orthosis. The tensile strength of the material is calculated by using the formula maximum tensile stress equals to maximum load over the original cross-sectional area. The material for the joint of ankle-foot orthosis is stainless steel, while for the shell is polypropylene. So that's all from me, and I will pass to Alya to explain the lab 2. Thank you.
So hi, my name is Dayana, and now I'm going to propose our second lab experiment, which is to study the range of motion of the sit-to-stand motion with and without AFO, which is ankle foot orthosis. Okay, so first I'm going to explain briefly about what spasticity is. So basically, spasticity is a condition which is a result from the upper motor neuron lesion, which involves either a single group or multiple groups of muscles. So ankle spasticity can be derived from diseases such as chronic stroke, spinal cord injury, traumatic brain injury, and others. So the problem lies when the patients face difficulty when resuming daily life activities such as walking, sitting, and standing due to restriction of motion of muscle around the ankle. So it is important for patients to use assistive devices to provide aid to them to enable sitting, standing, and walking as per usual. So sit-to-stand motion is one of the most carried out daily activities. So in our case, this motion is especially important because these are the first movements that they will perform after receiving treatments from wards. So in this experiment, we want to understand the effect of an assistive device, which is AFO, on range of motion. The assistive device used is ankle foot orthosis, which is normally used to improve walking patterns by restricting the movement of the lower leg and provides support to weak muscles. So in this experiment, the materials and apparatus used are plastic AFO, Vicon software, markers, and measuring tape. So the hypothesis of this experiment is that the range of motion measured in angle when wearing AFO is lower than when not wearing AFO. So our expected outcomes that at a natural speed of sit-to-stand motion, the angle measured from a horizontal line during the sit-off phase is 76.2, while the termination phase is at 79.1. So this experiment is divided into two. One is without AFO and the other one is with AFO. So first, without AFO, the healthy adult female subject is chosen to perform STS motion, sit-to-stand motion. So the inclusion criteria are including not having any lower leg disease or injury, Parkinson, or stroke. So subject is asked to wear tight clothing, and the measurements of anthropometry are also taken using measuring tape. And then markers are also placed on lower limb parts of the subject. So when markers are ready to be placed on the subject is asked to sit on a chair of a fixed height with arms crossed the chest like this to avoid the influence of inertia. So subject is asked to sit on the chair and adjust the position of the feet to be the same as the width of her shoulder. So subject stands when the signal start is given by our other groupmate. So subject is not allowed to stand with hands pushed off while performing this motion, and then the subject stands for 2 seconds before the motion capture is executed and the sequence of STS is captured in the system. So the process is repeated at least 3 times and all the data are tabulated. So for this part of experiment, it is basically the same process as without AFO, but the subject is asked to wear plastic AFO that we have chosen and is the appropriate size for her, and also some of the markers are placed on the AFO. So basically the whole process is the same, all the data are tabulated and recorded.
Assalamualaikum and hi everyone, my name is Danial Haikal with Effendy. Now I'll present about the lab 3. So lab 3 we do the force distribution on different padding during sit and stand motion. We have 3 different types of padding which are plastozoid, EVA and pilite. For your information, all the ankle foot orthoses need the best padding to reduce the height force exerted on the foot. Because comfortable padding is important for the patient to get the appropriate gait. It also ensures that the skin of the patient is comfortably bedded and does not directly come into contact with the rigid orthosis shell. So, this experiment used the force plate to detect and measure forces exerted on the ground during the sit and stand activity. The materials and apparatus that we are used in this lab are EVA, pilite plastozoid, vacuum system, and force plate. So, what the hypothesis for this lab? Thick padding is the best choice because it will reduce the amount of forces exerted on the force. So the expected outcomes is material with higher thickness will reduce the amount of forces exerted on the foot, and the graph will show the quantity of pressure for different types of padding. In result, pilite tends to have a low pressure since the materials are the most thick among the others. So how does this lab works? First, we need to prepare 3 different types of padding. A healthy adult female subject is chosen to perform the STS motion on the force plate. The inclusion criteria of the subject are not to have head and lower leg disease or injury, Parkinson or stroke, or we call it a healthy person. And third, the subject need to put their bare foot on the force plate without using any padding. Next, the subject need to do the STS motion on the force plate. We need to record the data received by the Vicon system. And we need to repeat step 2 and 3 by using the different kind of padding. Last but not least, we need to compare all the results that we get from the force plate. So that's all the methodology of this lab. Thank you.